Every time your heart beats, it's doing something amazing. It's creating pressure that pushes blood through over 60,000 miles of blood vessels in your body. But how does it push? Why does blood flow faster in some arteries and slower in others? Why does a blocked artery cause a heart attack? The answer isn't just biology, it's physics. Blood moves just like water through a pipe. Today we're going to use physics to understand how blood flows, why it sometimes doesn't, and how doctors fix that. To start, your heart pumps blood out, and it also relies on that blood to come back. It's not a one-way system, it's more like a loop. So the cycle repeats millions of times a day to bring oxygen and nutrients to your body and take waste away. And the physics behind this flow is what keeps it efficient and stable. Let's break down how blood flows to the body using this diagram. So on the left, you see a red artery. This carries oxygen-rich blood away from the heart under high pressure. Because it's moving fast, the flow is mostly laminar, meaning smooth and quiet. And we'll go into that in more detail later on. Then the blood flows into a network of tiny capillaries, and that's that intermediate, like webbed area in this diagram. And these are not; these are just like one cell thick, and this is where like most of the work happens, like the real work happens. And this is where oxygen leaves the blood and enters the body cells, and wastes like carbon dioxide get picked up during this. And then finally, blood enters the veins, so like it's like that blue area, and the pressure here is much lower. So the veins have these valves to prevent the blood from flowing backwards. And the blood now carries less oxygen and is heading back to the heart to start the cycle all over again. And it's important to note that blood flows from high to low pressures. So now that we kind of went over like some basic terminology, what actually makes blood flow? Your heart is essentially a pump, and every heartbeat creates pressure, pushing blood forward. This pressure is highest right when the heart contracts, and that's called systolic pressure, and it drops when the heart relaxes, diastolic pressure. So, pressure gives blood the energy it needs to move. Resistance slows blood, so similar to how like cars or like traffic slows down cars. So resistance comes from narrow vessels, long vessels, or sticky blood, which we'll go into greater detail later as well. Flow rate means how much blood flows through a vessel per second, and we write this as Q. One of the most important equations regarding blood flow is Posey's law, and this really explains how blood flow works, and it ties it all together. So here's the equation, and let's just break it down. So Q is the flow rate, as we mentioned earlier, and that's how much blood moves. And the R, the radius, is the width of the blood vessel. That triangle P, or the pressure difference, is the heart pushing versus the resistance. And then that funny N is the viscosity, and that just means like the thickness of the blood, and L is the length. So the most important part in this equation is the radius. And as you can see in the equation, r is raised to the fourth power. And this means that a small change in radius has a really big impact on the flow. So if a blood vessel narrows by half, the flow rate drops by 16 times. So to put this in perspective, let's do a little demo. So let's say both these straws are arteries, and I'm pushing with the same pressure when I'm pushing that red liquid into it. So like your heart does with the same pressure. But look how much harder it is to push the blood through the skinny straw. And this is like what happens during a heart attack or a stroke. So blocked artery has a smaller radius, and the flow almost stops. And remember, flow is proportional to radius to the fourth. And this is where that equation comes into hand, because if you go from 2 millimeters to 1 millimeter, that flow drops by a factor of 16. Now, to put viscosity into perspective, or through a demo, so viscosity, remember, is how thick a fluid is. So water is pretty fluid, or it flows easy, while syrup, we know, is like more sticky. So in some conditions like polycythemia or dehydration, this causes the blood to become thicker, and that raises the viscosity, and which ultimately reduces the flow. So Posey's law shows that viscosity, when viscosity increases, flow decreases. So the thicker the blood is, the slower the flow is going to be, which makes sense. And the heart has to work harder in that case. And when you're looking at the math, when that viscosity number is higher, you're dividing the other numbers by a greater number, so you're going to have a lower flow rate, or like the lower Q. So let's look at this in kind of like a hypothetical situation. So we have Mr. Seinstierwich, and he is 78. One morning, he slurs his speech and he can't move his right side, so he's rushed to the hospital. And when he gets there, the doctor diagnoses him, stating that there is a clot blocking an artery in his brain, and his blood vessel radius dropped from 2 millimeters to 0.5 millimeters. So using the equation or the law, we do 2 divided by 0.5 to the power 4, and we get 256. Now that's just a bunch of numbers. What that means is that his brain cells were getting 256 times less blood, and that's why time matters in stroke. So how does a doctor treat this? So the doctor uses something called TPA to dissolve the clot, and what that is just like a medicine used to break up the clots. And what it does is it turns a protein in your blood into something called plasmin. And what that plasmin does is it breaks down that clot. And then once that clot is dissolved, the blood vessel reopens and the blood can flow again. But I mentioned timing earlier, and it's important because you only have 3 to 4.5 hours, I think it is, to give TPA after a stroke, because after that, too much damage has already been done. It becomes irreversible. So if we do this quick little demo here shown, so if we have something blocking a straw, so in this case it's like clay, this shows that the flow stopped, and if we remove the clay, it resumes. So it's like me removing the clay would act as the TPA. Another important topic when it comes to blood flow is laminar versus turbulent flow. So understanding how blood moves helps explain everything from murmurs to strokes to how blood pressure changes with exercise. So what is laminar flow? Laminar flow is when blood flows in smooth, parallel layers. So think of like a calm, orderly river. The center of the vessel has the fastest flow, where the edges have slower flow due to friction with the vessel walls. And then each layer of blood flows smoothly next to each other. Laminar flow occurs when the velocity is low. So the vessel is wide, and the viscosity of the blood is normal. So an equation that ties into laminar and turbulent flow is Reynolds number, and that's the equation shown here. So in essence, if Reynolds number is less than 2000, then the flow is laminar. On the other hand, turbulent flow is chaotic, it's irregular, and it's noisy. So the layers break down and the blood starts to swirl and mix. And this happens when there's narrowed vessels, or blood near bends, or if blood is flowing too fast. And this is inefficient, and it requires the heart to work harder. And what this does actually, it causes vibrations that you can hear, and these are called murmurs. So to go back to that Reynolds equation, if Reynolds number is greater than 3000, then the flow becomes turbulent. So anything that increases velocity, like a narrow valve, or increases the diameter suddenly, or even reduces the viscosity, that can create turbulence. And something fascinating, I mentioned murmurs, and a heart murmur is the sound of a turbulent blood flow in or near the heart. So these heart murmurs occur when there's either a narrow valve, and I think it's called stenosis, and that's where it speeds up the flow and there's more turbulence, or it could be because there's a leaky valve, and that's when it lets blood flow backwards, so that's regurgitation, and it causes it to swirl, and then, or it could be because of a hole in the heart wall, so in babies, and that's when it also lets blood move abnormally. So you can kind of think of blood as a running river. So when a valve doesn't close properly, it's like a dam with a leak, right? So the flow becomes noisy, swirly, and non-laminar. So doctors use a stethoscope not just to hear a heartbeat, but to listen for these disruptions and how blood flows to the heart and vessels. So normally regular blood flow is quiet and is in laminar flow. But if something were to go wrong, like a narrowed valve or that leak a heart wall, or any of the ones that we mentioned earlier, the flow becomes turbulent, and instead of having the smooth layers like we mentioned, it swirls or spins or crashes into itself. And what this does is this turbulence causes vibration in like the vessel walls, and those vibrations travel through the body like sounds would like through a drum. And what doctors hear are these vibrations as murmurs or like whooshes or like an extra beat. So they're listening for that telltale sounds of like chaos and what should be like a quiet, steady flow. Now, not all blood is flowing smoothly, but when it isn't, doctors can hear it, and physics explains why. Something a little bit off topic, not related to blood flow, but related to how fluids act in pressures, which is similar to blood. If you take an IV bag, like IV drips, for example, so the higher the bag, the faster the flow. So that's like gravity turning height into pressure. And this is why like IV bags in hospitals are hung up high. So the pressure difference increases flow without using a pump. Now let's talk about aneurysms and Laplace's law. So an aneurysm is when a blood vessel bulges out like a balloon due to weaknesses in the cell wall. So the vessel gets wider and wider, but then actually it makes it more likely to burst because of that weakness. And what Laplace's law tells us is that tension is equal to pressure times its radius. So that tension is how much like pull is on the vessel wall, and then pressure is like that, like the blood pressure, and then the radius is how wide the vessel is. So as the aneurysm grows, the radius increases, so the tension increases too. So in this demo here, the wall of this vessel stretches as pressure increases. So, but as it gets wider, it also gets weaker because it's stretching. And that's what Laplace's law shows us, right? So eventually the balloon can burst, just like a real aneurysm if it's left untreated. So let's look at another case study to emphasize radius again. So Mr. Stuart Hazel is an 83. He gets chest pain when walking, and he goes to the hospital, and the doctor diagnoses him and says that he has plaque that is that has narrowed his coronary artery from 2.5 millimeters to 1 millimeter. And if we use that equation that we used earlier from Besai's law, 2.5 divided by 1 to the power of 4 is 39. And that itself is 39 like times drop in flow. So his heart muscle is not getting enough oxygen. And a common treatment for this is a stent. And what that is it reopens that valve, increasing the radius and restoring normal flow. So, like if we block a straw and we slide a tinier straw to stimulate a stent reopening the path. So today we use physics to explain how blood moves and how blockages, pressure, and thickness affect that flow.